14, translocation 11, 14, and translocation 14, 18. Okay, these are the ones common with the chromosome 4. Translocation 11, 14, and translocation.
Dear friends, I'm checking just 1 minute. Welcome friends, I hope all of you have written the exams of the test. I'll keep it open, my YouTube. Yes. So am I audible? Please post whether I'm audible or not in your so around 10 of you are joined. I hope all of you have written the exams of the test. Anshul, welcome Anshul. I'm just seeing whether everything is fine. We'll start now, just for 2 minutes. I'll keep things ready. So, am I audible? Okay, Anshul, we'll start the class. So we are going to discuss the 25 questions we had in test series. Now, let us see the questions one by one. So please attend this a short test series covering all the important questions of INISET. Definitely it will be useful for you. There might be a small delay of the class and the questions, but please follow. Let me explain you the important questions we had. So the first question we had for our class. The first question you had is very interesting question, very favorite question of National Board exams. A patient 50 years old developed a neurological disorder. Nutrition is started via method shown below. Which of the following is false statement? Okay. So it's a nice question. It's a very favorite question also the National Board exams also. So you can tell me what is the correct answer of this? So 50 years old developed a neurological disorder. Nutrition is started via the method shown below. So from the picture you can see this is a nutrition known as percutaneous endoscopic gastrostomy nutrition. Okay, this is a tube of peg tube. This is a peg tube showing you a small stab is made in the epigastric region and a tube is put inside the stomach. So now the question is nutrition is started via this method. Which of the following is false statement? So indicated for people who need nutrition for more than 4 to 6 weeks. Number one, yes, that's correct. This is done by endoscopic guidance. Yes, that is also correct. Pull through and direct stab techniques are used is correct. Ideal method for short bowel syndrome is absolutely wrong. Short bowel syndrome is a condition which will need a nutrition into the GIT. So already short bowel syndrome patients will be having severe loose stools and the gut is less than 100 centimeters. So we must go for a TPN is a preferred method for this short bowel syndromes. Okay. Okay, that's great, Sivaselvi, that's correct. So hope most of you have written the exams. Let me discuss the questions in depth now. Percutaneous endoscopic gastrostomy tube. So this is a tube inserted into the stomach with the help of endoscopy guidance. We put the endoscopy inside and we throw the light, and from the epigastric region, we can put a direct stab. We can directly put a tube into the stomach like this by a method known as stab technique. Or else we will pass a guide wire through the epigastric region. We pass a small guide wire that will be connected to a tube and it will be pulled through. So two techniques are there: stab technique, pull through technique. With these two techniques, we put a tube into the stomach known as percutaneous endoscopic gastrostomy tube. So please understand, this is a part of enteral nutrition like nasogastric, nasojejunal, and feeding gastrostomy, feeding jejunostomy. These are the four methods of commonly followed tubes. The PEG tube is used when you want to give a enteral nutrition to a patient for more than 4 to 6 weeks. Because if you want to give a nutrition for more than 4 to 6 weeks, we cannot put the tube through the nose. It may cause a little cumbersome for the patient. And very important, nasal tubes for more than 4 weeks will continuously cause aspiration and may damage the lungs by aspiration. So please remember, PEG tube is indicated for more than 4 to 6 weeks of enteral nutrition. Wherever you can give enteral nutrition, PEG tube can be used, and it is very commonly used nowadays for patients who had CVA or something. They will put a tube directly into the stomach without any major surgery. So it's a PEG tube, simple procedure done by medical gastroenterologists with the help of endoscopy. So please remember, total parenteral nutrition is a gold standard for short bowel syndrome. It's a gold standard for short bowel syndrome. No confusion in that. Okay. The answer is D. So any doubts you have, always post the doubts in the chat. But there will be a delay. I see the question and I will be answering you, but definitely I'll be answering your queries. So this is a first session on topic number, chapter number 1, general surgery, and chapter number 2, trauma. So therefore, any topic doubts, related doubts, you can always call me because I'm watching in another mobile about your doubts. So second question, Mr. Ramu was trapped in a collapsed multi-story building for 10 days. So Mr. Ramu was collapsed in a multi-story building for 10 days. He was there in the building and was recovered alive. So he was recovered alive and nutrition started for him. Immediately after starting the nutrition, he developed electrolyte imbalances. Which of the imbalance is not seen? Can you tell me? This is a case of clear-cut case of refeeding syndrome. The question is asking about refeeding syndrome. Okay, please remember, question on refeeding syndrome. The question is asking which one is not seen: hyperkalemia, hypocalcemia, hypophosphatemia, hypomagnesemia. Which is not seen? Yes, can you tell me which is not seen? So now, but this is a discussion going on for students who are already waiting for the exam next month. So please, we will discuss about final year preparation later. So now, please attend the questions and listen to the questions. Any doubts related to topics, you can always tell me. So this is a case of patient who was trapped inside a building who is not having any consumption of food. This is a condition known as refeeding syndrome. So please don't forget, refeeding syndrome is a favorite topic of national board exams. So refeeding syndrome is characterized by the following: 1, 2, 3, and 4. What actually happens when a patient who has been not consuming food for a long period will be given a huge amount of nutrition? The huge amount of glucose given will drive the glucose given huge amount will drive the insulin increase, and insulin increase, you know very well, will shift the potassium into the cells. So potassium will be shifted to the cells and results in hypokalemia. The first important problem is hypokalemia. So as hypokalemia starts, there will be slowly the positive ions may shift into the cells and may result in PCM decrease. What is PCM decrease? So phosphate, hypokalemia, potassium decrease already. So now phosphate, calcium, magnesium, all these will be decreased. So refeeding syndrome is characterized by hypophosphatemia, hypocalcemia, hypomagnesemia. Please remember, these patients will need slow refeeding. To prevent this condition, we have to do slow refeeding to the patients who are on nil oral for long period. This refeeding syndrome is a dangerous condition. It is most common with total parenteral nutrition than enteral nutrition. And these patients may die because of Hypokalemia-induced cardiac arrhythmias and cardiac failure may happen. Therefore, please manage these cases carefully by giving a slow feeding. Okay. So very good, Sivasan. That's correct. Very nice. So now next question. So please remember, these are interesting questions I have made. 10 years after hysterectomy, patient presents with fever and loin pain. The problem is happened in WHO surgical safety list. So WHO guidelines for surgical safety list has been released, and it is of 3 stages: sign in, time out, sign out. So what is shown in the image? Can you see what is shown in the image is a foreign body in the pelvis. That's a foreign body which is present in the pelvis on a CT scan, probably a missed out pad. Which condition this happens? Sign in, time out, sign out, time in. So the answer is very important classical question from surgical safety list. Please don't forget the answer is sign out. What is sign in, sign out? I'm going to tell you now. And what are the important features you should know? So WHO surgical safety list guidelines edition number 1 gives 3 columns. Number 1, sign in. Number 2, time out, and sign out. So I request you guys, please attend these elite test series sessions. I have made high yield INI set questions. Though it's a NEET series, I have made questions which are highly expected in INI set upcoming exam. All the important questions I have collected suitable for INI set, and I'm going to discuss each test series for only 1 hour to maximum 1.5 hours in a fast and rapid way. So you should appear for the exam in the evening or in the morning, and you should attend the test and discussion. This is one of the best method to go for revision. Definitely you will find it useful. Please attend this. So sign in is a phenomenon before induction of anesthesia. So before induction of anesthesia, what all will you do is sign in. I hope you know that consent will be signed, site of surgery marked will be noted. All those things will come and sign in. So time out is before skin incision. Before the skin incision is made out, you must be sure before skin incision, the surgeon, anesthetist, nurse should confirm the patient is a correct patient and the surgery we are going to do is on the correct side. So sign in, time out. Sign out is a question asked in you. So before shifting the patient out of OT, before shifting out of OT, it is our aim. What is our aim? Our aim is to look for, before shifting the patient out of OT, it's our aim to look for any missing gauze, pad, count, everything should be done before closing the abdomen or any sutures. So missing gauze, missing pad and all should be correctly numbered. Very important point. Missing gauze and missing pad should be noted, and any instrument malfunction should be noted. Any instrument malfunction should be noted. Number of units of blood used, blood units transfused, blood transfused should be noted. So all these are noted and sign out. So very important thing is missing of any foreign body should be noted. Missing of any foreign body or any needle or pad or gauze should be noted. In this case, you can see very well the patient has a missed pad inside. Patient is having a missed pad in this picture. Okay, you can see a classical picture showing you missing pad in this image. So this is a case of missed out pad. Okay, don't forget this image. So this is a picture showing you, table showing you the sign in, time out, sign out protocol. So history of any drug allergy, return consent, all noted in sign in. Sign out, any instrument problem is addressed. Look for gauze count, instrument count, and pad count. So prophylactic antibiotics is given is noted in time out. Time out is the before skin injection concept. The concept before skin injection is known as time out. Okay, please don't forget this. So here comes a very high yield question. Please remember, I have made all the questions only from Bayesian law. This series is completely a series from Bayesian law, and few topics may be taken from Sabiston. A patient named Mr. Ramu was operated for a inguinal hernia by a laparoscopic method, by TAP method, trans-abdominal periperitoneal method, comes to you with abdominal distension, guarding, rigidity on a 3rd post-op day. During laparoscopy, a metal trocar with a plastic sheath is used. Please remember, a metal trocar with a plastic sheath is used. What problem might have happened? That's the question here. What is the answer for this question? I hope you would have read this concept we have discussed in our video also, directly taken from Bayesian law. It is capacitance coupling injury. The answer is capacitance coupling injury. Let me discuss about the capacitance coupling injury and other coupling injuries of patients. So please remember, diathermy injuries in laparoscopy. from Bailey and Love. Diathermy injuries in laparoscopy. I'm going to make 3 simple images you can understand. This is abdomen. So this is the port. This is the primary port. And this is the secondary port. This is a secondary port. Primary port is used for passing the camera. Okay, this is a camera put in the primary port. Through the secondary port, I am passing an instrument for operation. So the instruments are well insulated and connected to a current. So these instruments are insulated so that there will be no injury to the nearby structure. So they are well insulated with a plastic sheet and we will operate here. So in first type of diathermy injury, if there is a bowel touching this instrument and this insulator is damaged, So please remember, number 1, insulator damage. It is going to injure the bowel known as direct coupling injury. Direct injury of the bowel during operation by applying the diathermy. First point. Second question. I am using a camera. This camera is usually made up of metal. I am now operating on another port and I am using this to operate some structure here. And this is connected to a diathermy. If by accident I touch the camera, I am touching the camera and the camera is in touch of some bowel, what will happen? The electrical energy will spread to the bowel and this bowel may get damaged. This is indirect coupling. So indirect coupling. So please don't forget that is known as indirect coupling. Direct coupling, indirect coupling. These all you can understand. Direct coupling means directly the damage of the instrument. Indirect means I'm touching the camera containing the metal camera that is going to touch the bowel. So indirect coupling. So these both cases will also present after 3 to 4 days because of the diathermy induced injury of the bowel. Most important question is, I am putting the camera here. This is second ports, metal port. I am passing the insulated sheet and I am operating here in this place. So please remember, it is a metal sheet with a plastic cuff. People are using a plastic cuff here. So plastic cuff, metal sheet. This is a basic physics from your school days. If current is passed through a metal, between the 2 metals, see, these are 2 metals, this one metal, it will generate a current. What is that current? It will generate a current known as capacitance current. Usually this capacitance current created will be carried through this metal, and if this is also a metal, will be carried on the skin to the earth plate. So if it is fully metal, the current generated in this will touch the skin of the patient and will go directly to the earth plate and there will be no electrical burns. If I use a plastic sheet like this, the current cannot go through the abdominal wall skin. So what will happen? The current is generated here and if this port is touching any bowel as shown in the image, if this port is touching any bowel, that bowel will develop the burns. This is known as capacitance current injury. That's a classical injury which happens when you use a metal port with a plastic cuff. Please remember, with a plastic cuff. Anyhow, this type of cuffs are not available now. Nowadays, we are using either a fully metal cuff or a fully plastic cuff will not have this injury. So therefore, please use either a fully metal cuff or a fully plastic cuff for your practice. So now you can see this image showing you classically a metal port covered with a plastic cuff here. That is the given. During laparoscopy, a metal trocar with plastic sheath is used. What problem might have happened means the current would have been spreading here and it is touching the bowel, will cause this capacitance coupling injury, which the patient may come late. So usually diathermy burns are usually due to poor insulator. So many hospitals, they use old laparoscopic instruments and that can cause injury. So among these things, insulator defect is one of the common reasons for bowel injury. Okay, common reasons for bowel injury. Okay. Mrs. Kumari underwent gastrectomy. Mrs. Kumari underwent gastrectomy for a cancer stomach and abdomen closure was planned. The laparotomy wound length was measured. Please remember, the abdomen laparotomy wound is measured. It is 15 centimeter wound. The surgeon now decides to close the abdomen using Prolin sutures. What should be the minimum length of suture to be used to close the abdomen? Okay, this is a 15 centimeter wound. So what will be the suture length needed? So this rule is known as Yes, anybody? This rule is known as Jenkins rule. Very good. This rule is known as Jenkins rule. Jenkins rule is the length of suture needed to close the abdomen into 4 is equal to the correct answer. The answer is 60. So Jenkins rule is a rule used to close the abdomen. What length of suture should be ideal? So abdomen closure is done with the help of proline or with the polydiaxanone. So polydiaxanone is the longest absorbable suture with an absorption period of 180 days. So previously we were using proline. Now everywhere we are using polydiaxanone, and Jenkins rule applied, it is totally 60 centimeters should be the correct answer. Okay. So this is again a repeat question in AIMS. A surgeon completed modified radical mastectomy. He asked the junior resident to complete the surgery. Which of the following suture material is used to put subcuticular sutures? Please remember subcuticular. So this is a very classical question. Abdomen, linea alba closure, proline. So I want to tell you some closures you should never forget. The answer for subcuticular closure is monocrile, which is nothing but polyglycaprone. Polyglycaprone is the answer for this subcuticular sutures. So welcome, Lailuja. Good evening. I hope some of you are attending the sessions from our institute also. Nice to see. Anyhow, we are going to have classes from next week onwards. So better to attend. So now let me tell you what are the sutures, what are the places that is more important for your exams. What are the sutures, what places you should use them. Don't forget the answer. One-line points I'm going to tell you. Abdomen wall, that is linea alba. What is the suture material of choice? Proline. 1 number. This is now replaced by polydiaxanone. Polydiaxanone has replaced proline, number 1. Hernia raphe. Hernio-raphe. Answer is again the same proline. Tendon repair. Tendon is cut. Achilles tendon cut. Again proline. One size. All these are one size. Diaphragm suturing. That is also proline. Proline is a very important suture. Hernio-raphe, tendon, diaphragm, linea alba. Most importantly, for vascular sutures, vascular anastomosis, the answer is proline. Again, it is proline. Depends upon the size. For example, aorta, we close with 2-0 proline for aorta. So like that, its size it becomes smaller and smaller when you go further. So pancreatic duct is also proline. Proline is used for pancreatic duct also. So please don't forget, these are very important places where we use proline. Now let me tell you where we use vicryl. Vicryl is nothing but polylactic acid, violet in color. Polylactic acid, which is violet in color. It is a gold standard suture for bowel, bile duct. Please don't forget, vicryl is called as workhorse material in the OT. It is a very important suture material. Without that, we won't go to OT. So bowel, bile duct. Bowel is sutured with 3-0. Bile duct to suture with 4-0 vicryl. It is used in subcutaneous closures also now. Subcutaneous closures. Some surgeons, we still use vicryl for subcuticular suture also. But recently there came a white vicryl, which we call it as monocryl, which is nothing but polyglycaprone. Polyglycaprone is nothing but white vicryl, the gold standard for subcuticular sutures. Gold standard for subcuticular sutures. One latest suture is polydiaxanone, which is 180 days absorption period, is used for abdomen closures nowadays. It is used for linea alba closure nowadays. Okay, just have a clear idea about the basic sutures which are used for an ionized exam. So this course is mainly meant for ionized. Though this series is named as NEET tests, I have made this course purposefully for ionized questions. So Mr. Gupta developed a trauma and is treated in the hospital. Okay, the false statement regarding ebb flow phase that happens to him in the post-trauma period. So post-trauma, patients undergo a physiological phenomenon known as ebb flow phenomenon. This is the first chapter of period now, ebb flow phenomenon. So in this, there are two phases, ebb phase and flow phase. Ebb phase is the first 24 hours phase. In the ebb phase, patient is in so much of stress. Stress hormones are in enormous amounts like catecholamines, cortisol, aldosterone. Flow phase is the next phase. After ebb phase, the second phase, after 3 to 10 days, it is flow phase. The flow phase is further divided into two phases. Please remember, the flow phase is further divided into catabolism and anabolism phase. So catabolism phase and anabolism phase. Please remember, F phase is first 24 hours. Patient is in shock. Flow phase is catabolism and anabolism. It extends from 3 to 10 days is catabolic phase. Anabolic phase is 10 to 60 days. It is two phases, catabolic and anabolic phases. This question is not asked in the exam, but highly expected directly from Bayesian law. First 24 hours of F phase, catecholamine, steroids, aldosterone, stress hormones are released. Catabolic phase is from 3 to 10 days. It is a phase where patient is going to lose many of his important energy substances. Temperature increases, oxygen consumption increases, there is a negative nitrogen balance, BMR, basal metabolic rate increases. So for maintenance of energy of the patient to live the stress, these are all happening. To maintain the patients, to sustain the stress, these are all happening. So you know well, insulin, glucagon, cortisol, catecholamine, again the same stress hormones are released. But insulin is released in excess, but insulin resistance is there. Therefore, patients may go for increased sugar levels. Increased sugar levels in catabolic phase. Anabolic phase, this is an important question which can be asked in exam. Anabolic phase extends from 10 days to 60 days, which will show you the growth hormone and IGF are increased. Please remember, this is an anabolic phase. Some Anshul Sharma is asking, which is the most common and safe suture to be used in roadside accident lacerations? So laceration of the skin, we have to always use ethylon. Okay, laceration of the skin, we have to use ethylon. Ethylon, which is nothing but nylon. Nylon sutures are best for skin suturing, especially when there is a laceration in the road traffic accident. The infection rate is less in nylon because it is monofilament. If you use silk, it is multifilament. It can cause more infection. Okay, that's a very important thing. You should not forget this question. The answer for this question, F flow phases. Catabolic phase of flow model is associated with increased growth hormone is wrong. It is anabolic phase of flow model has increased anabolic growth hormone. Okay, please don't forget. Follow the questions. If you have doubts, please have it in your mind. I will clear your doubts before closing the session. Okay. So here comes a very favorite topic of Bayesian law. I have taken all the questions only from Bayesian law, so you need not worry. All are straightforward, standard questions which can be asked in INISET as well as NEET. Which of the following is best method for hair removal to avoid surgical site infection? Surgical site infection is a nightmare for the surgeons. When we do some surgery, if there is so much of infection in the skin, it can cause more chances of surgical site infection. So surgical site infection, very important, you should not forget. New concept is nowadays we should not shave the patient. No shaving is in fact advised. No shaving is advised. Previously in our hospital, government hospitals, what people used to do, the barbers will come in the night and they will charge heavily and they will go for a complete shaving. When they are shaving, they do multiple abrasion that will cause bacterial colonization. And when I do surgery next day, it can cause infection to the patient. Therefore, new concept is no shaving. Sir, I don't do hairy fellows. If you feel like that, you can do shaving, or we can do remove the hair in just before entering the OT, or hair clippers on the table is best answer here. So best answer here is hair clippers. Nothing but hair will be removed by that simply without abrading the skin. That should be used on the table will be the better answer. Okay, this is a direct. Preoperative shaving is undertaken in operating theater before surgery, because after clean wound surgery may be doubled if shaving is performed the night before, as a minor skin injury by the barbers will cause superficial bacterial colonization. So cream depilations is messy. So hair clippers have the lowest SSI. Direct line from Bayesian law. Hair clippers have the lowest SSI. We should use hair clippers. So here comes another interesting concept from Bayesian law. ERAS. ERAS is a new concept in surgery. So in India, we see even hernia patients, we admit and keep them for 2 days, even 3 days also we keep. But there is a concept now, even for major surgeries like colectomy, even for major colectomy, C-rectum operations and all, they are going to do enhanced recovery after surgery protocol. That is nothing but fast-track surgery. Surgery is done, patient gets well and gets discharged soon. That is known as fast-track surgery. So what are the things that will be helpful for a fast-track surgery? So before going for a fast track surgery, what are the things to be done? 8 hours fasting of fried and fatty meals. Yes, it must be done. 8 hours don't give fried foods or fatty foods. First point. Then 2 hours before surgery, high carbohydrate juice is given, especially in colon surgery. So this helps in fast recovery of the patient after the surgery, because high carbohydrate load makes the patient recover from surgery very well, because energy is very heavily uploaded. Mid-thoracic epidural anesthesia, the main reason for this type of enhanced recovery is because of the epidural anesthesia. Yes, we can give epidural anesthesia. Clear liquids are given after a few hours of surgery. See, we used to do when colon surgeries are all done, we used to keep those days even 5 to 6 days nil oral. Now, clear liquids can be given even few hours after surgery. Nasogastric decompression is used intra-op and post-op period is wrong. Okay, we don't use nasogastric tubes in the fast track surgery. Please understand, this is a very important slide you are seeing here now. Before enhanced recovery after surgery protocol, in ERAS protocol, before surgery, what all things the patient can eat? 8 hours before, he should complete his fried food or fatty food. Okay, fried chicken, whatever he takes, or a fatty food he is taking, or a meat he is going to take, it should be stopped 8 hours before surgery. See, but we usually advise not even take for 24 hours. Please don't follow what we do in practice. But enhanced recovery is totally different. No fatty foods, no fried foods, no meat or chicken, anything. 8 hours, he should be not eating this thing. 6 hours, he should only have a fasting. 6 hours or more fasting of light meal, light idli, 2 idli, non-human milk. Milk should not be taken after 6 hours, or infant formula should not be given to the babies after 6 hours. 6 hours of infant formula, non-human milk. Breast milk can be given in babies. Please remember, if a baby is going to be operated, breast milk can be given. We are discussing a baby who is going to be operated, for whom non-human milk like cow's milk and all should not be given for 6 hours. This is a very interesting line. 2 hours before clear liquids can be taken. During the clear liquids, high carbohydrate load is also advised now. High carbohydrate load, 2 hours before can be high juice. Clear liquid with high sugar amount can be given. Okay. So am I clear? Any doubts you can post? Are you understanding the question or anything you need? Please have in your mind. We are going to discuss the doubts also. But question related doubts you can immediately ask. Immediately ask any doubts in question related. Okay. So recommendations of ERAS, NG tube is no more done. Enhanced recovery after surgery advises no Riles tube, no drains. No Riles tube, no drains. Please don't forget this. 35 years male, Mr. Ramu was planned for laparoscopic surgery. Surgeon puts a small incision at the umbilicus level and takes 2 sutures on the rectus sheath and enters the peritoneum using a special trocar. This technique is known as what technique? There are 2 techniques of insufflating gas. I hope you know there are 2 techniques of insufflating gas in the during surgery. Yes, I'm watching. So there are 2 techniques of insufflating gas. One is Veery's needle technique. Another is Another is what technique? Another is, please don't forget, one is Veery's needle technique and another is open technique. In open technique only, we use this Hassan cannula approach. Please remember, we open the abdomen. We open the abdomen by a small incision in the umbilicus and we put the port inside and we put the port under vision. So under vision, I'm seeing what is there inside, opening the peritoneum, putting inside. This technique is a safe technique in the way we will not injure any major vessels. In Veery's needle, we blindly insert. But in Hassan cannula, we can insert it under vision. So this open technique is efficient and safe overall. Safe and overall, a safe technique than a Veery's technique. So many surgeons are trained well with open technique, but some people still, we still use Veery's needle technique only. Veery's needle technique is a regular MCQ, but this question can come for your exam. Please remember Hassan's technique of insertion of needle. Okay. Insertion of this port. 60 years male with the BPH treated as emergency with the Foley's catheter for presentation with acute retention of urine. This question is a repeat question. He didn't turn up for 1 month and now on arrival, we are unable to remove the Foley's catheter by deflation. What is the ideal method to remove the Foley's balloon? So patient had a Foley's catheter. Now Foley's catheter, the channel got crystallized and got blocked. So what is the reason for crystallization? Means many times people use saline instead of distilled water. When you use saline, that can get crystallized. Distilled water is the ideal fluid to be used to inflate the balloon. Don't use saline. If it is now crystallized and blocked, what are you going to do? That's the question. If the channel is crystallized and blocks, I am unable to deflate, so I am unable to remove the catheter. Answer is yes. This fast track surgery, what we have discussed, Anshul, we should not apply in all surgeries, but these are all under study. Enhanced recovery after surgery is under study. People have started to follow this because we cannot do a ERAS for a esophageectomy. We cannot do a ERAS for a Whipples. So they are all under study. People have started to doing slowly ERAS for all the surgeries. Okay, now it is very commonly done in colorectal surgeries. ERAS is very commonly done in colorectal surgeries. So this question answer is blow the balloon with distilled ml, 20 ml distilled water and burst with ultrasound guided puncture of the balloon. That's the answer for this 11th question. Please, no more confusion. Best way to deal this is inflate with 20 ml water and ultrasound guidance, percutaneous puncture should be done. Okay. So all these questions and explanations are available in your elite test series. So please go through these questions, are very classical questions asked in the exam. Mr. Ramu, 30 years male, developed a blunt trauma abdomen. Please don't forget. And admitted in a secondary care center with ultrasound facilities. There, the surgeon there wants to plan laparotomy based on DPL, Diagnostic Peritoneal Lavage Test. False statement regarding this procedure. Anybody? Correct answer is DPL. Wrong statement is cannula is inserted below the umbilicus, and if more than 10 ml blood aspirate is seen, it is positive. That is true. So please remember the question, the blood is missing. More than 10 ml frank blood aspirate is seen, it is positive. That is true. Since laboratory facilities are not available, he tested the aspirate with a urine dipstick. This is acceptable from Bailey and Lowe. Bailey and Lowe gives this line. Urine dipstick test is acceptable if there is no count and all cannot be done because it's a sick time. So I can do a dipstick which will show you the blood positive or everything will be shown in that dipstick test. The DPL is especially useful for patients with multiple injuries who is hypotensive and needs to exclude abdominal injuries. Yes, DPL is only indication now as per Bailey is this because E-FAST has replaced DPL. The only use of DPL now is for multiple injury patients who is hypotensive and needs to exclude abdominal injuries. Only those cases we are using now. In penetrating trauma, minimum of 1 lakh RBC is positive is wrong. It is 10,000 RBC per ml is positive. In blunt trauma, only 1 lakh RBC. In blunt trauma, 1 lakh RBC is positive. In a penetrating trauma, even 10,000 RBC per ml is positive. Okay, this is a classical question. DPL for blunt trauma is more than 10 ml aspirated is positive, 1 lakh RBC positive, 500 WBC positive, amylase present positive, food particles present is positive. In penetrating trauma, the values are just 1/10 of it. Like 10,000 RBC per ml is positive. If lab facilities are not there, we can use urine dipstick analysis. That is correct. That is also correct question, correct answer. Okay. Please don't forget DPL. DPL is a high yield topic. DPL and E-FAST both can be asked in the exam. So be thorough with especially these values. 10 ml of frank blood, 1 lakh RBC, 500 WBC, amylase positive, food particles present. This is classical blunt trauma positive. 1/10 value is positive for penetrating trauma. So you are called upon to evaluate a burns victim. You note that he has a burn surface, the 41% burn surface area. It is a very high grade burns. In addition to resuscitation means we give oxygen, fluids, antibiotics, everything, painkiller, everything will be going. What is the most important step that should be given? Very important step. Oxygenation, nutrition, broad spectrum antibiotics, prophylactic intubation, which is the correct answer in this. This is a direct line from Bailey and Lowe. We have to give prophylactic intubation for any patient who is having 40% or above. That is why they have mentioned 40%. When will you intubate a burns case? When the total body surface area is more than 40%, suspected airway injury, patient is having that nasal hairs and all are burnt. Singing of hairs in the nose means that flames are inhaled, so you can have respiratory injuries also. Hoarseness of voice, the airway injury, hoarseness of voice, more than 40% of the total body surface area is recommended from Sabiston. So Sabiston recommends in burns more than 40%, you should prophylactically intubate. Okay, important question, please don't forget. A 45-year-old man is brought to emergency room with suspected splenic injury as he is hemodynamically unstable and has positive fast. Hemodynamically unstable, positive fast. He is taken up for exploratory laparotomy. Intraoperatively, he is found to have an expanding subcapsular hematoma. So expanding subcapsular hematoma, more than 50% of the spleen surface. So please remember the grading is according to hematoma. Grade 1 is less than 10% hematoma. Grade 1. 2 means 10 to 30% hematoma. And sorry, more than 30% hematoma is grade 3. More than 30% and expanding is grade 3. So this question should better go for grade 3 hematoma is splenic hematoma, grade 3. So expanding hematoma is a dynamic finding. So it can be seen only intraoperatively. It cannot be seen on imaging. Please understand that. So if it is a expanding hematoma, it is a very big hematoma. It is expanding. In a CT scan, less than 30% is, less than 10% is grade 1, 10 to 30% is grade 2, more than 30% is grade 3. But in intraoperatively, they're asking intraoperatively, if it is expanding, means it is expanding maybe more than 30%. So let me say it is any expanding hematoma in the spleen seen intraoperatively is grade 3 and AAS severity. So it's a grade 3 and very severe injury. So this is grade 3 as per AAST guidelines, American Association of Trauma Guidelines. So a 60-year-old gentleman is brought to trauma center with history of polytrauma. He is unable to give a verbal response to your question. He is unable to give verbal response. When you're asking something, he is unable to speak. Verbal responses, V is not able to respond. V5. On examination, you note he is having laryngeal crepitus. So V5 is what are the verbal response scores? Let me tell you the verbal response scores now. I used to tell the mnemonics for verbal response in head injury patients as 1, confused, word, sounds nowhere. This is a mnemonic. 1 means patient is oriented. He is able to speak. I am Mr. Ramu. I am admitted here. Like that, he is able to speak. Oriented. He is confused. He is saying, "Where am I?" Like that. Word, inappropriate words he is using, scolding someone unnecessarily. Incomprehensible sounds he is making. So he is not able to make a verbal response score in this question. Not able to make a verbal response. We go for V1. On examination, you are seeing a laryngeal crepitus. That means there is a damage in the larynx. Suspecting airway compromise. Intubation was planned. So patient had an injury in this area. So you are trying to intubate. But there is difficulty in intubating. Usually what intubation we make? Orotracheal. Orotracheal 1 time, orotracheal 2 times. It is very difficult to intubate. That there is a fall in saturation. The patient is getting fall in saturation when you are going to try to intubate. What is the ideal airway in this patient? This is a simple first MBBS question. Patient is not able to enter through larynx. We have to go for tracheostomy. Okay, tracheostomy is the correct answer here. Very good. Most of you are correct. That's correct. Fall in saturation between 2 atoms is an indication of surgical airway. Since the patient is having a laryngeal crepitus, they might be having an injury to the cricothyroid region. So here is an injury here. So better go for a tracheostomy, which is also a surgical airway. That will be ideal airway for him. So don't go for a cricothyroidotomy. Go for tracheostomy. The 2 surgical airways are cricothyroidotomy and tracheostomy. So better to go for tracheostomy in this case. A patient was recovered from a snow trap. Patient was trapped in a Kashmir somewhere else and he's trapped in a snow. He's treated in the casualty. On examination, his lower limb is having blisters and some areas of gangrene in his digits. So this is a case of frostbite. Please don't forget this is a case of frostbite. What will be the ideal treatment of choice for this case? So frostbite, how will you treat them initially? That's the question. This question is directly taken from Bailey and Love. Rapid rewarming done at 42 degrees centigrade bath is a correct answer. But this is actually wrong. Bailey says that, so you follow that. Bailey in page number 6632 mentions initial treatment of frostbite will be rapid rewarming in a bath of 42 degrees. That's direct line was asked. This question is a direct repeat. But in another page number 422, Bailey says gentle rewarming is done, but no temperature is mentioned. So sometimes Bailey may be written by different part of authors, and the correct answer is actually gentle rewarming only. If you see for any other any other super specialty books, answer is gentle rewarming. But this question is asking with the temperature. Probably the examiner took the line from this page showing rapid rewarming at 42° back. So please go for C. If temperature is not mentioned in this question and there is another choice, gentle rewarming, I will go for gentle rewarming. But this question is mentioning rapid rewarming at 42°C bath. It is direct line from Bayesian law. Okay. Patient had burns all over his body. Surgeon wants to decide the degree of burns. Regarding the finding the burns depth, false statement is. So let me explain you this question. The answer for this question is pinprick is absent in second-degree deep burns is wrong. Okay, this question let me explain. Answer is B. This question you must know, understand from Bayesian law again. All the questions are from Bayesian law only. So there are burns are, this is involving the epidermis. This is epidermis is known as first-degree burns. The burns involving the dermis. This is dermis. This is superficial dermis. This is deep dermis. Superficial dermis is known as papillary dermis. Deep one is reticular dermis. Then comes subcutaneous tissues. Going here is another burn. So let me tell you the burns category. First degree burns involving only epidermis. Only epidermis is first degree burns. Involving dermis is of two types. Second degree burns involving up to papillary dermis is superficial papillary dermis, second degree burns, and going deep to the reticular dermis is deep second degree burns. And the one which is going to the subcutaneous is third degree burns. So very easily you can differentiate them by seeing certain findings. First degree burns will have erythema, painful erythema. Second degree burns will have blisters. Third degree burns will have scars. But initially what happens? Patients will be rolled up here and there, and the blisters will be broken when they brought to hospital. So we will have difficulty in differentiating second degree superficial, second degree deep, and third degree burns. I am going to take two simple tests. A cotton swab and a pin needle. Pin cotton. Cotton is a superficial touch. Pin is a deep prick. I'm going to test it. Both are normal in second degree superficial burns. Cotton is also normal. Pin prick is also normal. Cotton is also normal. Pin prick is also normal. In other words, superficial touch is normal. Deep pain is also normal. When you come to second degree deep burns, please remember cotton touch is absent. Pin prick is present. Pin prick is still present in second degree deep burns, which is totally painless, means third degree burns are painless. Cotton touch is also absent. Pin prick is also absent. These are all discussed in our app. In a burns chapter, you can go through, but please don't forget how to differentiate first degree, second degree, third degree burns. First degree easily differentiated because it's only having a painful erythema. Second degree blisters being broken up, we have to touch it with the cotton and pin and say, who will have superficial touch absent means it is second degree deep burns. Who will have pin prick is also absent means third degree burns will have pin prick also absent. Please don't forget this question. Classical question from exams. The answer is pin prick sensation is absent in second degree deep burns is wrong. It is absent in third degree burns. Please don't forget this question. The probe views in EFAST. So EFAST is a procedure which is done for all blunt trauma patients when they come to hospital. Old fast, what we used to do is, we keep the probes in right, left, epigastric, pelvis. This is the old probe. 4 places only we keep. EFAST we keep in the right chest and left chest also. So how will you keep the probe? This way we keep the probe in liver. This way we keep the probe in spleen. This way I keep the probe for seeing the heart. And this way I keep the probe for pelvis. Both ways. This is horizontal. This is longitudinal. This is longitudinal and horizontal. That's the question. So how will you keep the probes in various types of EFAST? So subxifoid transverse view. Correct. This is transverse view. Right upper quadrant longitudinal view. Yes, correct. Left upper quadrant transverse is wrong. It should be longitudinal like this. Suprapubic, both longitudinal and transverse views are used. So answer is C is wrong. C is wrong. Okay. Simple question from radiology. Actually, this is a question from radiology, not there in Bailey, but this question is already asked in exams. So patient was admitted following a road traffic accident. Casualty team wanted to do log roll examination False regarding log roll examination. So patient is admitted to casualty. We are going to do log roll. I hope you know what is log roll because this revision session, I hope you all would have read already and we are ready for the revisions. And especially this is mainly for people who are appearing for INI set to have a clear-cut recall of all the important INI set related areas. So log roll is done by 4 people, one person standing in head, one person standing on one side, another person standing on one side. All these 3 will rotate the patient simultaneously to the other side. And the 4th person, you are the 4th person, you should go and examine the spine. Log roll is used to examine the spine for fracture. So there are totally 4 people needed. Log roll is contraindicated in pelvic fracture. We should never ever do log roll. Perrectal examination was done during log roll for an anal sphincter reflex. We will see whether the anal sphincter reflex is preserved or not. Indicated mainly to rule out spine injury. It is not a part of secondary survey. It is a part of primary survey only. A, B, C, D, E. It comes under E exposure log roll. This is no more done because it is now replaced by the classical procedure known as WBCT, whole body CT, has replaced log roll. Please don't forget this, has replaced log roll. Okay, thank you. Thank you, Anshul. Thank you. This is a totally replaced the log roll. So WBCT is a correct answer for replacement of log roll. So log roll is a part of primary survey, not secondary survey. So please don't make mistaken log roll. So never forget to do perrectal examination when doing the test of log roll. Okay. So olden days, we used to look for floating prostate known as Vermeulen sign. That is no more advised. Previously, we want to look for urethral injury also by doing a Vermeulen sign. That is no more advised. In fact, log roll itself is no more advised. So this is a repeat question again. In fast, which of the following needs immediate surgery? So there are 3 zones I've shown. This is zone number 1, zone number 2, zone number 3. Zone 1 is a middle zone where injury can happen to aorta or IVC. Hematoma, retroperitoneal hematoma zones. These are known as retroperitoneal hematoma zones. In the center, if there is a hematoma like this, I should immediately explore because it might come from aorta or from IVC. If aorta is bleeding, we have to use maneuver METOX. METOX maneuver, left visceral medial rotation. All the viscera from here will be rotated here and go inside. That is METOX. If IVC is bleeding, rotate all the organs this side and go this side. That is known as right side visceral rotation. Known as what? Kettle-Brash maneuver. So Kettle-Brash maneuver for IVC, METOX maneuver for aorta. Second is kidney injury. So kidney injuries are usually managed by non-operative management. 3 is pelvic injury, pelvic vessels causing a hematoma. So 3 is treated by pelvic binder. Nothing else needed, pelvic binder. So the answer here is who will need immediate laparotomy is only 1. Only 1 will need immediate laparotomy. Okay. So this question is a NEET, INI set 2020 question. Okay, INI set 2022 question, 2022 question. Asked in May. Following blunt trauma, 4 X-ray chests are given. You have to identify what is X-ray chest. So this X-ray chest finding you have to see. So this second one is can you see full gas, pneumothorax. The third one is a picture showing you flail chest, multiple ribs fractured, flail chest in multiple places. The fourth one is a hematoma collected inside known as hemothorax. You should be thorough with all the images. Hemothorax, pneumothorax, flail chest. And what is this? In this, you can see a bowel gas shadow is seen here. So it is probably a diaphragmatic injury with the bowel coming into the chest. So you cannot put an ICD into this because if I put an ICD in the diaphragmatic hernia directly without further evaluation, I may put that ICD tube into the bowel and can leak the bowel contents outside. So who will need further evaluation is A will need, which is nothing but diaphragmatic injury will need. The same question was asked previous year as a single line question in same aims. So please remember, INI set questions will be repeated. This question is going to repeat again. All the explanations which are given there are in the Elite test series in DocTutorials. Please go through the Elite test series in DocTutorials and read the explanations whichever I am telling you. A young male shown in the image sustained a stab injury on the anterolateral aspect of the abdomen and he is presenting with a BP 120/80, pulse rate 80. This question is also an INI set question asked last session. So this is a penetrating trauma, bowel is falling out. What should I do? I was shocked to see many students wrote answer as need further investigation, CT abdomen, etc., etc. This answer is very clear. When the bowel is falling out, we have to open and see what happened inside. The bowel itself is coming out means what? There might be some other injuries inside. Immediately we should do laparotomy. This is a directly protocol from Balian law. So you can see abdominal stab wound, shock, peritonitis, evisceration, hemodynamic and instability, free air, exploratory laparotomy. So what are the indications of opening a stab abdomen patient? Immediately next to hover itself, patient is in shock, patient has peritonitis, patient is having evisceration of the contents outside, hemodynamic instability, free air on X-ray chest. This is from Sebastian. INI set examiners will ask few questions from Sebastian also. Please remember this INI set question. When the bowel is showing outside the abdomen wall following a trauma, will need immediate laparotomy. Okay. A patient with a blunt trauma presents with a flank ecchymosis. His vitals are stable. Which of the following investigation is best to localize the site of bleeding? So blunt injury, flank ecchymosis, injury may be due to kidney injury, pancreatic injury, something will be injury in the retroperitoneal organ. So the injury is in retroperitoneal organ. Retroperitoneal organ, the investigation of choice is CT abdomen. This is a simple radiology concept. Okay. So retroperitoneal organ means always you should go for a CT abdomen. Okay. Fastest, normal, we have to stable patient, we should do CT. Always fastest, normal or not, we have to do a CT. And especially when there is a ecchymosis, we must definitely do a CT abdomen to look for any other bleeding. So 24th question in relation to skin suturing, false statement is. So with the needle and skin, I'm going to suture. The way I should enter the skin should be 90 degrees. I should enter the skin at 90 degrees and should come out at 90 degrees. And when I'm putting a skin suture, if this depth of the wound is X, I should follow X 2X rule. I should put a suture like this at X distance. Okay, X is the distance, I should pass the sutures and put a knot. So X, and next suture should be put at 2X distance here. This is 2X. So like that, X 2X rule, angle must enter at 90 degrees. Distance between alternate sutures must be follow the X 2X rule. Best suture material is nylon or silk. Nylon is commonly used in trauma and other because chances of infection is very less with the nylon. It is monofilament material. We should use round body needle. No. So if you see, if this is a needle, if I cut and see, it can be three types: round body, cutting, reverse cutting. Ideal for skin is cutting needle. Round body is for bowel or bile duct. Cutting should be used for skin sutures. Okay. Reverse cutting for vascular sutures. Please don't forget bowel and bile duct. You should use round body needles only. Okay. What are the various shapes of needle? There are many questions from the shapes. J-shaped needle is used in vagina. Quarter circle needle used in eye surgeries. Half circle needle used in bowel, bile duct. Composite needle like this used in oral cavity. These are repeat questions. Images from Balian law. Okay, please don't forget the image. So this is the last question of the first test. In scoring of surgical site infection, which of the following is not correct in asepsis score? Which of the following is not correct in asepsis score? So asepsis score is made up of A for additional treatment needed, S for serous discharge, E for erythema, P for pus discharge. Another S for stay is inpatient is prolonged more than 14 days. I is for not induration of wound. It is isolation of bacteria. Isolation of bacteria. So please remember asepsis score, A for additional treatment needed, like drainage of pus, antibiotic, debridement. S for serous discharge, E for erythema, P for purulent discharge, and another S for suppression of the wound, wound gapping. Isolation of bacteria, yes. Stay inpatient prolonged more than 14 days. Stay as inpatient prolonged more than 14 days is yes. So I hope you all have attended. Out of 25, I don't know how much you have got, but if you are getting more than 20 in this test series out of 25, you are in a competition to INI set. You are eligible to get a rank in INI set. This is a paper made from recent questions, from deep concepts in Balian law. Definitely, if you're going to score more than 20 in the first two chapters, you have high chances of getting a top rank in INI set. So please keep attending the Elite test series by DocTutorials. Elite test series is a test series made for elite people who have prepared well, who have been in topmost knowledge, who want an extra bite, this elite test series will help you. So please recommend any of your such friends who have already done extraordinary preparation and want to learn something new and want to have some extra ideas. He can always join this elite test series, and I will be here to clear those doubts also correspondingly. So we have finished test series 1 topics. Okay, test series 1, general and trauma, we have finished. Probably this test series will be going in the night times only between 8:30 to 9:30. So please follow that program in DocTutorials. Whenever there is a session, I will inform you. Probably we might have a session tomorrow, 8:30 to 9:30. Okay, thank you. Any doubts you have? Anshul Sharma has attended very well. I mean, asked so many doubts. Thank you so much. And I hope others are also, those who have not attended the session, please share this with your friends and get clarified. If you have not attended, if you have joined off the session, please attend the session. But before attending the session, I request you to download DocTutorial app and attend the test in Leaderboard. Leaderboard is having 25 questions test series. So you have to attend the test series and then come for this discussion. Then only it will be good. Okay. Thank you, friends. Thank you all. See you soon in the next session. Probably tomorrow.